بسم الله الرحمن الرحيم. Assalamu alaikum wa rahmatullahi wa barakatuh, everybody. This is SIGA's Ramadan webinar series. Today is day number 9 of Ramadan, and for the record, it's the 2nd of May. Today we will be with you with Dr. Munzir Al-Khatib, Mu'taz Al-Khatib, my apologies. Dr. Mu'taz Al-Khatib is from Hamad bin Khalifa University. He will be speaking to us today about Dr. Mu'taz is going to be speaking to us about Islamic ethics and pandemics. I would like to welcome all of our audience to this Ramadan webinar series, and I'd like to welcome Dr. Mu'taz Al-Khatib. Speaking with you, Dr. Abdurrahman Migdad. I am research fellow at SIGA and assistant professor of Islamic economics at Istanbul Sabahuddin Zaim University. I'd like to introduce Dr. Al-Khatib. Dr. Al-Khatib is currently an assistant professor of methodology and ethics at Hamad bin Khalifa University in Qatar. He studied Islamic studies in Damascus and Arabic literature at Al-Azhar University. Al-Khatib was a founding member of the International Forum for Innovation 1999. He was previously editor-in-chief of the Islamic and Contemporary Affairs page on Islam Online. Al-Khatib was a visiting scholar at various places. He was a visiting fellow at ZMO in Berlin and also a visiting lecturer at both the Islamic University of Beirut and Qatar University. He lectured at various reputable academic institutions, including Berkeley and Princeton University. Al-Khatib has authored and edited several books and over 20 academic articles. For today, we will be listening to Dr. Mu'taz Al-Khatib speaking to us for about 50 minutes. After the 50 minutes, we'll take your questions, and I will read out your questions to Dr. Mu'taz. We'll take a few rounds of questions for the remainder of our lecture, inshallah. So if you have a question, use the question and answer button that you see on your screen. Dr. Mu'taz, welcome on behalf of SIGA, Center for Islam and International Affairs. You have about 90 minutes, inshallah, and then we'll open it up for question and answer. Please.
Thank you very much, Dr. Abdullah, for this introduction, and thanks for Dr. Sami for hosting me and inviting me to speak to you, all of you. Let me just first of all make sure that you said 1-5 or 5-0.
5-0, of course. 15 minutes.
Okay, 50. Because I heard 15. Okay. بسم الله الرحمن الرحيم. الحمد لله رب العالمين وصلى الله على سيدنا محمد وعلى آله وصحبه أجمعين. وبعد. So today I'm going to talk about Islamic ethics and pandemics, which is a current issue today in this very difficult situation. And I hope that we all will, inshallah, pass this difficult time with better situation and stronger virtues at the personal level. First of all, I would like to just give a few points as an an introduction before I start my my discussion. The first point that I would like to stress here that most of the discussions focus on medical questions, but we rarely dealt with ethical issues. If you follow the media and the newspapers and the public discussions about coronavirus. So this is why I decided to focus, to dedicate my efforts and to address the ethical dimensions of what's happening and what's happening these days. Whether in my articles, weekly articles, and in my discussions and lectures. So. People, the second point that, as an introductory point, that we should remember that people and governments underestimated the risk of the virus at the beginning, and maybe because they thought that it was extremely far in China, so we were not involved in. So maybe this caused the late strategies or policies to prevent the spread of the virus. The third point that I would like to stress here as an introductory in my introduction, that there were even ideologization of the virus, whether religiously or politically, because the virus was instrumentalized to blame or to support or to prove some ideas that were taken for granted for some people, whether in politics or in religion, like to take the virus to support, for example, the legitimacy of niqab, or the legitimacy of not taking hands between women and men. Or to instrumentalizing the virus to prove or to spread the idea of mu'amala, that this virus was made intentionally as part of biological war or something like this. So these are different points that show us how this virus was addressed by different parties. Still, you know, the ethical dimension is a bit marginalized in these discussions. So this is why I'm going to focus on this. So in this talk, I will address the need for ethical values and principles in planning for and responding to outbreaks of infectious diseases. I'm going to answer three questions here in my talk. The first question is, why do we need ethics? And the second one is, how can we approach pandemics ethically? And the third question is, what are the key moral principles and values that govern pandemics policies? So let's start with the first question. Why do we need ethics? Usually and simply, I usually define ethics as a field that helps us to answer three key questions. What should I do? How should I live? And to define the sources that help me to answer the first two questions. So to define or to decide what should I do, I need source or sources maybe, and to decide even how should I live the lifestyle that it deserves to be lived. Even I need sources to decide what type of life that it should be lived. So simply, ethics helps us to understand or to answer these three questions: the actions, virtues, and the sources. The sources that help us to answer or address the first two questions. This is, we usually call that the third question, we usually call it meta-ethics. So when you zoom out of the questions or the specific cases and think of the system and the sources that help you to understand or to answer the specific and apply the questions. Now, so ethics helps us to set our priorities and then set the right courses or the right course of action in response. Even what behavioral and institutional change requires ethical justification. So we always need to justify, to provide justifications to convince people to change their behaviors, or to justify or prove what we consider as right or wrong, or what we consider as evil or good. So this is because the principal goals of public health must be balanced with other important values, as we will see later. So finally, why we need ethics to succeed in transforming these days of tension and uncertainty to again be ones of happiness. So health is a condition for freedom now, as it's clear for everybody, because if there's no health, or if there's a fear of spread of virus, then everybody will, especially in the context of contagion, so everybody will be affected negatively. So health is a condition for freedom, as it's clear nowadays. And even health is the necessity for worshiping God at the religious level. So I remember that Imam Al-Izz mentioned this point in his book Al-Qawa'id Al-Kubra, that taking care of the health of your health is a condition for worshiping God, because unless you will not be able to worship God, even if you are sick or in a difficult situation, difficult medical situation. So and even health is the foundation of benefits. أساس المنافع. We cannot go far talking about benefits unless the basics, the necessity of life and health is available, and then we can go far beyond that and talk about other benefits. This is why الصحة نعمة, the key benefit and the foundation benefit of benefits. Now let's move to the second question. Now I answered briefly and intensively the question, why do we need ethics? Now the second question is, how can we approach pandemics or ethics of pandemics? Here, I think there is difference between medical and ethical questions. With medical questions, we are talking about practical questions, revealing questions, like help, because science has a revealing power. It's not a normative power this is what I claim. It's not a normative power, even though that there was a movement which is scienticism during the 19th century and even during the 20th century, but still I think science has not a normative power, but it has revealing power. But this revealing power will affect and impact our actions and judgments. We can realize this and consider this through the medical information available, whether in the classical time or the modern time. The medical information was changed, and this affected our ethical judgments and even juristic judgments and rulings. So medical questions normally, usually they are informative, practical, revealing. This is what I'm saying now. Like these questions are such how do we stop the spread of the virus, for example, coronavirus? What treatments will save the most lives? Now, what about the ethical questions? Ethical questions they are usually normative, not descriptive, not just informative as the scientific questions or medical questions, and they are theoretical and applied at the same time. And this is why we classify bioethics as one of the applied branches of applied ethics branches. So these questions, they are many. We have a lot of ethical questions regarding pandemics and coronavirus, for example, specifically. So these questions, such as who should be treated first? Do travel bans harm more than they help? What research should be top priority? How should unaffected nations offer support for hard-hit countries? Are the cases of isolation and quarantine that are in effect ethically justifiable and proportional or proportionate? Do these interventions minimize the infringement upon individual freedom? And even the key controversial issue nowadays is when isolation treatment unavoidably leads to the shortage of drugs, equipment, and medical staff. Like what we know now, there was a huge discussion in the Western media about what we call it allocation scarce resources, allocate scarce resources in the time of pandemics. So this issue or this dilemma leads to the following question: like, how do we ensure equitable access to and fair allocation of these resources? Who should be treated first? How can we prioritize, set our priorities to treat these people? Because at the time of pandemics, no medical system is able to treat a huge number of patients at the same time. Not because of because this is unusual, you know. So this is why medical doctors they have to and hospitals they have to take decisions and prioritize these people. What should they do in this case? So this is not a scientific question, but it's an ethical question, and this is an ethical dilemma. I will address this issue later and give some criteria and what are the values that govern this such case, for example. So these are just some ethical questions, and there are many other than this that show us the complexity of the situation and the place of ethics in our daily life, and whether at the practical level or applied level or theoretical level. So ethics of to answer the question, the second question that I mentioned, so ethics of pandemics can be approached from different angles. We have to keep in mind that these angles these angles that address the public health and policies at the first hand, and medical ethics, which usually address the health of individuals. So because public health usually address the population health, and medical ethics addresses the individuals. And at the same time, when we talk about the values that govern the different angles that we can address ethics of pandemics, it covers also two types of ethics, named normative ethics and virtue ethics. With normative ethics, we usually deal with actions. So we evaluate actions itself. But with virtue ethics, we don't talk about actions, but we talk about virtues, the actor himself and the doer himself, not the action itself. So with normative ethics, we deal with actions. With virtue ethics, we deal with the doer and the actor himself. Now, these angles can be, I listed 4 angles that help us to address ethics of pandemics. The first angle is public health ethics. As I said, public health ethics is a way of looking at population health concerns and policies. And public health actions need usually to incorporate clear and systematic procedures founded upon ethical principles. And we need ethical justifications when we talk about public health ethics to make people believe their governments and put the health of others before their own convenience and movement. So how can we do this? How can we convince people, public people, to listen to our instructions as public health policymakers? We need to come and to provide them with justifications, convincing justifications, to let them take our instructions seriously and to be able to listen to our instructions, even to put it in action. Here, when we talk about public health ethics, we usually find two frameworks. The first framework usually focuses on the emphasis. They focus only on the individual level, the individual rights. How do we limit restricting individual rights? Limiting people's freedom of movement is generally an action that infringes upon what many see as a basic human right. So the interest of the first framework is the individual rights, and the individual rights should be prioritized over other rights. The second approach is usually focuses on the community rights, as they consider the highest value is on group well-being, not on individual. And in the context of pandemics, we will find this controversial, or this debate between the two frameworks. Islamically, I think it's more from a juristic approach. It's more inclined to the second framework, which is which focuses on the human being, or the group well-being value. This is for the first angle public health ethics. The second angle that we can address ethics of pandemics from is the ethics of quarantine and isolation. Many countries now, they implement quarantine and isolation, medical isolation or social isolation, because we differentiate between the two types. Social isolation is voluntarily done, and medical isolation is just to isolate the patients only from others. And with quarantine, we are talking about blocking down a big number or huge number of people in a specific city or country or such place, and to enforce them, to prevent them from moving out of the restricted area. And these people, we cannot guarantee that all of them are patients or even some of them. So you put all together in just one place, and you enforce them to not move outside of the borders, the restricted borders. So the quarantine was a controversial issue during the 19th century, because the quarantine is a medical means, was implemented by Western European at that time, and it was conceived differently in the Islamic countries at that time, and we can find many discussions or debates about this issue, whether it's acceptable or legitimate or illegitimate from an Islamic point of view. But at the end, it was this issue raised, quarantine raised juristic and theological questions, and even political ones sometimes, because it was, we cannot ignore that colonialism was part of these implementations at that time. Even when the conference was organized in the 19th century to cancel the Hajj, the call came from France at that time for this conference to discuss the plague was spread at that time, and to take a decision to stop people from moving and even traveling. So politics was part of these discussions at that time even, and in addition to the theological and juristic discussions, of course. So now, this is a second angle that we can address ethics of pandemics. The third angle is ethics of emergency preparedness. With emergency preparedness, we have to be aware that there's difference. Personally, I differentiate between normality, necessity, and emergency. Muslim jurists are familiar with necessity, and under necessity, they don't differentiate between different types of necessity. But in this case, in the context of pandemics, I personally differentiate between what I call necessity and what I call emergency. In light of the bioethical discussions, contemporary bioethical discussions. So with necessity, we usually deal with something stable, and it's almost stable. But with emergency, we are talking about an ongoing narrative or drama unfolding. And it's often surprising or over time. So our evaluating of the situation can be changed from day by day, like what's happening, for example, these days with coronavirus. So this is why the evaluation should be updated day by day, because we are talking about emergency, not necessity. not just necessity, but emergency. So with emergency preparedness, we are talking about a dynamic activity, a form of practice with external goals and inherent values. So it's an ethical dilemma. How are you going to balance between these different elements in such situation, which is ongoing? It's not stable. And your decisions at this time in this situation should be fast and suitable to the emergency case. So you have to take decisions quickly, very quickly. And how can you guarantee that your decisions will not be arbitrary or unjustified? The fourth angle here is normative and virtue ethics. With normative and virtue ethics, we, as I explained before, I'm not going to repeat the definition between normative and virtue ethics, but the context of pandemics, in the context of pandemics, we usually talk about moral panic. So there are key values here can govern. So we talk about solidarity, consolation of patients, tasliyatul musabin. We have literature about this issue in the Islamic tradition. We have patience and satisfaction, being patient and satisfied. الرضا والصبر, being patient and satisfied even to what's happening psychologically and even theologically. And we talk about tawakkul, trust in God, and all these virtues will affect the psychological situation of the people to avoid what we call moral panic during the pandemics and plagues or specifically or pandemics in general. So with normative ethics, we usually address questions related to actions in the context of pandemics, what are the proper actions should be made in the situation. As I mentioned before about the allocation scarce of resources, and even at the individual level, what should we do to prevent or stop the spread of the virus? How should we act? What are the necessity measures should be made here at the individual level? For example, not overbuying even to give a chance for others to find the products and their needs. Thinking of others at this time, very difficult time, because we know that there are many people, many individuals who live day by day. They are not able to and with this blocking down everything, these people will be affected negatively and intensively because of this very difficult situation. And the cognition of communal destiny, المصير المشترك. So how can we have to take care of ourselves and of others even at the same time, because any action we are talking about, whether we are talking about plague or pandemic or epidemics, so we are talking about a shared destiny, and any individual action will affect negatively others. So we cannot separate the individual from the collective. aspects at this time. Now, let's move to the last question, and I think I still have 10 minutes. Okay, so what are the key moral principles and values that govern pandemics, or our actions and policies during pandemics? Here we can, first of all, I would like to stress that most of the discussions, most of the issues related to the key moral principles here are related to the individual's responsibility to abide by instructions, the authority's responsibility to protect public order, and the intersection between these two areas, the individual's responsibility and authority's responsibility. Now, to balance between these two responsibilities, the individual one and the authority's responsibility, we are talking about set of values here, like, for example, the protection of life and health, the value of individual liberty and ethical justifications for its restriction in the context of emergency preparedness, justice and preparedness, ethical responsibilities toward persons and groups with special vulnerability, professional obligations, and divided loyalties for health professionals, etc. So we are talking about set of values here. Now, the difficult question is how to do balance between these different values when they contradict each other. This is the very difficult question, and we cannot generalize, give general judgment or rulings, but this is why we need to go for specific cases or applied cases to judge accurately these cases and different circumstances. For example, before giving examples here, I would like to give another point, a methodological point here. When we talk about governing moral principles, we usually talk about moral judgments that they require ethical reasoning and setting the criteria and balancing between different values and principles. So it's not just relying on very general rules or values. It doesn't help us to conduct an ethical judgment accurately, which should be suitable to the case that at hand. So this is why we need ethical reasoning. We need to put criteria. We need to balance between different values and principles in our ethical judgment. And defining the values here that govern actions and policies during pandemics is not an easy action. So let's give specific examples now. For example, when we talk about public health as a field, public health ethics as a field, we usually talk about 4 key values that govern this field. So we talk about solidarity, we talk about efficiency, we talk about integrity, we talk about dignity. So these are the key 4 values that govern this field, the field of public health ethics. Now, if we go for the example that I mentioned before, like how can we set the priorities for who gets treatment or who gets a hospital bed, in the Western discussions, there's no agreement on this issue, who should be treated first, but the discussions are revolving around different criteria. For example, some people said that the sickest people should come first. Some said that the people with a higher possibility of surviving should come first. Others said that healthcare workers should come first because they are working on the front line. But Islamically, as I discussed this intensively in one of my articles published on Al Jazeera Net in Arabic, I put 4 criteria to set the priorities in this situation. The first criteria is the patient will. So the patient will should come first. If somebody said that I'm going to do ithar, to altruism. So then we have to listen to his will. If he preferred to come second or third or whatever. So if he did ithar to give the chance for another person. The second criteria is that the people with a higher possibility of surviving should come first. Why? Because the value that governs this judgment or this situation is saving lives. Now, if there's no higher possibility of surviving, then we are not saving the life of the patient that at hand, and at the same time we are taking the tool or the means that can be by this tool we can survive another life, because the tool itself has a value here. It's not just a neutral tool. It has a value. So we should not waste this value, or we should not waste this value just to do an action which is not useful, or there's no high possibility of surviving for this patient, for example. The third criteria here is the sickest people who need emergency intervention. So we cannot move from one criteria to another unless all the patients are equal in the first criteria. Then we move forward to the second criteria and the third one, and so on. So, and the fourth criteria, when we have many patients and we have a limited number of hospital beds, and all the patients are equal with a higher possibility of surviving, and they are equal with the sickest, with their needs for emergency intervention. Then we move forward to the fourth criteria, which is healthcare workers, because they are working on the front line, and if we keep their lives, they will help us again to survive. To save other lives. This is what we call it maslaha muta'adda. It's not an individual benefit, but it's collective benefit, because these doctors will help us, or these health care workers will help us to solve will support us, especially if they got this disease because of their works, because of they were working to save lives, others' lives. Now, for isolation and quarantine, we have specific criteria to justify or unjustify, not justify these restrictions or these measures. So quarantine and isolation are justified, ethically justified, if it is effective in controlling the epidemics, and if it is proportional to the severity of the epidemic, or if it is necessary for controlling the epidemic, or if it is taken with minimal infringement of individual freedom and rights, and if there is a transparent to the public even. So the key value here that governs these criteria is la darar wa la dirar. When we talk about which is a very key value here, which as it was mentioned in the prophetic hadith, which says there should be neither harming or reciprocating harm. Do I have more time, or should I stop here?
Yes, you can continue for another few minutes.
Okay. So now the last point here, when we talk about justifying liberty limiting practice, how can we justify liberty limiting practice or movement? So there are there are 4 key principles that govern this issue. These values are, or these principles are, preventing harm, and please keep in mind that we are talking here with pandemics. We are talking about relational autonomy. So we are not talking about just individual autonomy, because, as I said before, the separation or the space or the link between individual and collective is not anymore existing at the time of pandemics, because all the governments around the world are seeking for fighting this virus. Then any individual action will affect the others. So there is no separation between individual and collective in this situation. So this is why we are talking about relational autonomy, not individual autonomy here. So preventing harm is one of the key values here, and proportionality here is so isolation before quarantine comes before quarantine. Proportionality is a key value. So there should be balance between our measures or our policies or actions and the situation that is existing. So if there's no proportionality, then we are talking about, because some governments will take this as a golden chance to restrict or to control the individual freedom, and we have to be cautious with these actions and policies. The third key value here is reciprocity. If individuals sacrifice their liberties for the common good of the society, then the society has reciprocal obligations to provide those individuals with needs such as food, shelter, and psychological support, and to protect them from discrimination, damages, or penalties as a result of quarantine. So, for example, in Sudan or in some African countries, that the government cannot just lock down all the country and without providing these people, the poor people who are living day by day, without providing them support to live, or without giving them their needs. So unless there will be between two worse scenarios, whether they will die by not finding their food and their needs, daily needs and necessary needs, or they will die from the virus, because of the virus. So this is an ethical situation that some countries put their citizens in. And this is why, for example, in some countries like Turkey or Syria, they try to minimize or control the movement, but they give space space for people to move or to do their work in a very limited situation. To avoid paying the financial price or the financial price of the full lockdown of the country. The fourth key value here is the transparency, to let citizens know how to protect themselves and to let medical and public health personnel know which effective and appropriate interventions should be taken in the situation. These are my answers to the three key questions that I mentioned in my introduction. So I hope that this is sufficient, or this addresses my questions. And I will leave the floor for the questions. Thank you very much for listening and for being for listening to this talk.
Thank you very much. Okay, thank you very much, Dr. Mu'taz Khatib. Dr. Mu'taz Khatib is the professor of methodology and ethics at Hamad bin Khalifa University. He kindly spoke to us, just as a reminder, about Islamic ethics and pandemics. He thoroughly covered the topic in terms of ethics and in terms of the medical dimension, and how both medical and ethical dimensions generally differ, where the first is informative, practical, and the second is generally normative, theoretical, and applied. He mentioned basically three main questions that he addressed and talked to us about, and he kindly also answered. We have, Dr. Mu'taz, we have some of the questions I would like to start sharing with you. Some will take a few for each round, and hopefully take as many rounds of questions and answers as long as we have time. Let me start by asking this question: your thoughts on the dominantly secular nature of today's mainstream bioethics and mainstream medical way of thinking. Do you see this as one of the main obstacles in the development of the coronavirus bioethical discourse? Another question: Islamic ethics and medical ethics. Do you observe any difference in light of managing pandemics? That we have generally Islamic ethics and there are medical ethics. Generally, there are slight differences or major differences in light of this contemporary pandemic we are going through. Have you observed any major differences in managing this pandemic? And a third question: doesn't the Islamic history provide us with lessons learned for us to follow during times of pandemics? Maybe if you can shed some light on this as well. Let's take those three questions and we'll hopefully come for another round. Dr. Mu'taz.
Okay, thank you very much. Thanks for these important questions. As for the secular discussions, if we observe the kind of discussions biomedical discussions about the coronavirus, and especially the public discussions about the mosques and churches, we can realize that there is a bias against religion. When we deal with this, they ignore the religious discussions, and they usually there is a kind of trying, to blame Muslims and Christians or those who are religious people because they cause this problem with their gatherings and their religious activities. But at the same time, there is no focus on the sport activities and other gatherings, So it's a kind of blaming because of the religious secular bias against religious people or religious activities. I'm not saying that these activities are, ethical or unethical, because I myself criticized some of these opinions that they insisted on keeping or remaining the mosques and churches open under this very risky situation. But I'm against of only focusing on these people and trying to blame them because of that. This is my point. But we can keep criticizing this type of thinking, whether it's Christian or Muslim or Islamic positions, that where they have this idea, metaphysical idea that these places are very pure and they are sacred places, so they cannot carry the virus, which doesn't respect the natural laws of God, the natural laws that made by God. Because we always keep the line or the link between what we call it al-irada al-takwiniyya wal-irada al-tashri'iyya, the legislative will, the divine legislative will, and the universal will. And these should come together, and we have to keep our actions in line with the natural laws, not out of the natural laws, because so our beliefs will not give us infallibility from being sick or from getting this virus, but because there are natural laws. So whether but it's also in this situation. With gathering prayers or Friday prayers or these collective activities, religious rituals, will increase the chance to get this virus more than other gatherings. So, and in the Islamic jurisprudence, we have a lot of options. We have much flexibility dealing with these issues. As for the historical experience that we have, of course, in our history, in the Islamic history, we had a series of plagues and pandemics, a huge number, many. It started from the time of the Prophet, based on some historical narratives, or it started at the time of Umar ibn Khatib, So, but for sure we know that the first plague what Muslim witnessed in the history was the Amwas plague, Ta'un Amwas. It was on 18th Hijri. So at that time, this plague raised theological and juristic questions about what to do in this situation. So, and there was disagreement between the companions themselves. Some of them they just submitted themselves to what they considered as a divine predestination, and some others resisted this predestination with another predestination. You know, so like what Umar ibn Khattab did, and what Amr ibn al-As did, and what others did even. So we have these controversial, and we have this debate between the companions themselves. But later we had a huge literature on plagues. Adabiyat al-Tawa'in. You know, we have many books written about plagues, and some scholars who wrote about plagues, they died because of the plague. You know, for example, like Imam Suki, like Imam Ibn Hajar al-Asqalani, he had two daughters died because of plague, and he wrote a book on plague. He himself didn't die because of plague, but his daughters, two of his daughters, died because of plague, and some others, many others, died because of this. But they wrote about this issue. But at that time, we have to keep in mind that there was a huge discussion about the contagion. Is there contagion or not? Because of some prophetic reports that they deny the existence of contagion, and some others they prove that there is contagion, and Muslim scholars disagreed about this issue. But the contagion itself didn't cause Muslims to find means like social distancing, for example. Now, it was not existing at that time, and this is a modern idea. This is a modern conception. So they didn't think of doing or making social distancing because of their conception of the contagion, or because their conception of plague itself. Plague has a mysterious character at that time, based on their medical information that it was available at that time. So the medical information at that time was saying that the plague comes because of the air corruption. But this medical interpretation was deeply criticized by Muslim scholars with very strong arguments at that time. So, but now the medical information that are accessible for us is much different than that information in the classical time. And because of the epidemiology now, we have a specific scientific field which is called epidemiology, and we can know why these plagues or pandemics are, and what the mechanisms behind these pandemics, etc. This information will affect our judgment and will push us to create new means to stop the spread of this type of pandemics. You see, now as for the last point, that for the Islamic bioethics, and we have a specific field or branch of ethics which is called Islamic bioethics. Now, what's the difference between bioethics, secular bioethics, and Islamic bioethics? With Islamic bioethics, it's still, Islamic bioethics is still a new field. It's not mature field yet. But there's literature on this direction, and it's going better and better by time. But with the main difference here is the sources. If you remember that in my introduction, when I explained what ethics is, I said that how should they do, what should they do, how should they live, and the sources. Now, what characterize Islamic bioethics is the sources that we use. And Islamic bioethics, as the field of ethics in general, is an interdisciplinary field, which includes theology, Islamic theology, jurisprudence, fiqh, Islamic legal theory, usul al-fiqh, Sufism, and the genre of adab, what we call adab. There's a huge genre on adab in the Islamic tradition. So integrating all these fields involving all these fields in your judgment, ethical judgments, this is what we call it ethics as interdisciplinary field. And sometimes in our college, in our program on applied Islamic ethics, we do master on applied Islamic ethics, we differentiate between interdisciplinary and transdisciplinary. When we talk about interdisciplinary, we are talking about moving and transcending the borders between the different branches of Islamic knowledge. Theology, philosophy, Sufism, jurisprudence, Islamic legal theory, etc. And transdisciplinary, when we move out of the Islamic tradition, out of the Islamic knowledge, the branches of Islamic knowledge, to involve or to be involved in the global discussions, whether in moral philosophy, Western moral philosophy, and bioethic, secular bioethics, to be in line with them and to answer the question they're being raised in this situation, and to benefit even from them, not just to ignore and isolate ourselves, you know? Yeah.
Okay, thank you. We have two questions. The first simple, the second a bit compounded. You answered maybe the first half of the second question, but I'm just going to read it all so it makes more sense. And then we also have another round, so let's save some time for the third round. First question, can we observe some differences in the performance of Muslim countries versus non-Muslim countries? Does or has Islamic ethics played a role? Second compounded question, how do Islamic ethics differ from general ethics that are not Islamically based? We've covered portions of that. For example, in the capitalist system, health has become a for-profit business, and where the pharmaceutical industry makes billions at the expense of people's health. We have seen these effects clearly in this pandemic. Does Islam have a theory or position on the issue of health? And this last portion of the question is important. We'd like to hear from you. How can we as a society advance research and development and progress in health, medicine, medical equipment, drugs, without this profit incentive, if possible, given that we look at this pharmaceutical industry making billions of dollars as maybe an unethical industry? What are your thoughts on that?
Okay, so let's start from the last question. Do we have a theory on health, Islamic theory on health? I don't claim that we have, you know, but we should answer first. How do you conceive what we call Islamic here, you know? So Islam is not a scriptural, just the scriptures, and you know, and it should be there should be everything in the scripture. No, Islam. This is why we you know, when Hodgson differentiated between Islamic and Islamicate, you know. So what do we mean by Islamic here? If I'm not going to use his classification or his terms. So when I say Islamic, I mean the process of interpretation, which is ongoing process all the time. So it's our obligation to add or to improve knowledge in this direction. So it's not there in the text, but we have a very rich and a huge tradition that help us to build that theory. You see, based on the conception that I already explained before between interdisciplinary and transdisciplinary, and based on the concept of ethics that I proposed in my talk, etc. So it's our obligation nowadays, al-wajib al-ma'rifi, now for today, is to build these theories and to develop Islamic philosophy addresses the contemporary questions or the questions of our times. So we cannot blame the classical Muslim scholars. Why didn't they develop this? Because we can. It's our obligation to do this. They will not answer all the questions forever. It's our obligation to do this and to develop and to build on their knowledge. But at the same time, we have to be aware of our tradition, the richness of our tradition, and there are many literature that help us to develop this theory. But it's available and it's spread in different branches of knowledge, of Islamic knowledge, like theology and even Sufism and jurisprudence and Islamic legal theory. So we have to develop this. It's not existing yet, but we have to develop it based on specific methodology, and we have to develop our methodology first to create this theory. Now, the difference between ethics and Islamic ethics, I already gave some comments about this. The key issue is the sources that we use. One of the key issues, even that with Islamic ethics, we are seeking for the divine will, not just our options and our individual choices. So in Islamic ethics, we keep searching for what satisfies God. What is the divine will? So we define what's right and what's wrong based on the divine will, and the divine will is defined based on our process of interpretation, which is evidence-based interpretation. It should be evidence-based interpretation. It's not just what I think it's the divine will, and it can vary from a scholar to another. It's fine, but each interpretation should be based on arguments, concrete arguments, and systematic arguments at the same time, with clear sources, Islamic sources, that with scripture, with even we have two types of sources: the scriptural sources and non-scriptural sources or non-textual sources. Even in the Islamic jurisprudence. So this is not a novel issue that we didn't face in the history, but it's been always there. This is, I think, this is my comments. Yeah.
Okay. There is this interesting question that says, how do these measures and principles apply when the patient is a refugee or a non-citizen? Don't saving lives take another dimension when it is situated at the intersection of state exclusionary laws, when some lives matter more than other lives according to the modern state structure? How do we think of Islamic principles then? This is one question. Another person asks that you didn't mention how to balance these values when they contradict or collide during such situations. I believe it is in reference to situations of life and death, whose life to choose and whose not to choose. I'm going to take one more question for this round, and we'll see how time works out. Can herd immunity be considered an acceptable ethically justifiable response according to Muslim ethics, because some suggest that it imposes on people uncertainty, risk, and is an irresponsible solution that would be exercised at the interest of economic gain over preservation of life.
Sorry, I didn't get the last point, the last question.
Okay, basically it's asking about the herd immunity. Wouldn't that be considered, the question is, can that be considered acceptable, ethically and justifiable, and a justifiable response according to Muslim ethics, given it prioritizes economy over individual or human life, right? So is it or is it not considered an ethical response, and what is the Islamic position on that? Okay, so basically questions are stated as is. Maybe we try our best to make the sense out of them. There's two more questions. Let me just read them out. Maybe you can also combine. When a human right of free choice to wear or not a protection mask clashes the public requirement to follow the rules, which ethical values can help to solve the contradiction? Last question. Did I get it right? The person asks, ethics is the right way. Ethics is the right way to doing something. Isn't ethics the broader search to right way? I wonder, is ethics only fiqh? Isn't it akhlaq also in Islamic terms? I think we can take those final questions. Inshallah, listen to Dr. Mu'taz.
Okay, so these are very interesting questions. As for the first question, the key value here is that all human lives are equal. So we cannot prioritize one life over the other based on the ethnicity or the citizenship or the economic situation or economic class or political position or etc. So we have to keep this value as a universal value, that all lives, all human being lives are equal as a universal value. Now, after that, if we have to choose, as I mentioned before, that when we have very limited resources and we have to choose. So we agree that this is a universal value, that we have to save all lives. Now, but we cannot, in this situation, in this emergency case, we cannot. We have 100 beds, for example, hospital beds, and we have 500 patients. Now, how can we prioritize? The question is not about saving lives. The question here is how to prioritize between these patients to allocate the resources that you have. In this case, we have we have to do balance between, first of all, we have to set the values, the key values that govern this situation. The first value is saving lives, because human life is sacred. Now, the second value is justice. Because we have to be just with all patients at the same time. We cannot give a priority for one over the other based on personal preferences, because this will affect or violate the key value here, which is justice. Now, the third value here is that we have to save lives. There is a moral responsibility and moral obligation that I have to support or help people who need help, emergency intervention, if I am able to do. إسعاف من يجب إسعافه, So in the classical expression, in the classical fiqh expression here. So how can we do balance between these three values? We need criteria to apply, to implement these key values on the case that at hand. So we have to have criteria. So what are these criteria? So I provided 4 criteria in my talk, how to prioritize these, So number 1, I said the first criteria we should consider is the patient's will. If he chooses to be not prioritized, to give others the chance for saving their lives, then we have to listen to his will. Now, some people will say, no, he has no right to do this. I will say that, okay, there is another value here in this case, because there's ithar, and ithar, doing ithar, give the preferences to others, is one of the Islamic values. And this is why, for example, Imam al-Juwayni said that this is هذا فعل الصالحين. This is the action that was made by the righteous people or the good people. So this is number 1. Now there is nobody said that he would give the preference for others. Each one would like to take the priority. Now what should we do? We have to come with the criteria. So the first criteria is, because we said at the beginning that the key value is saving lives, then we cannot give the machine for anybody or any patient, even including those patients there's no high possibility to survive them. Why? Because in this case, I'm not saving the value, saving lives. In this case, I'm wasting the value itself, and I'm violating the value by taking the chance from others that can be survived if I will give them this machine. The third issue here, that the machine itself has value, as I said, because هنا تعينت وسيلة للحياة. You see that this machine is selected, is the only way to save lives. Then it has value itself. It's not just a machine. It has value itself. Then we have to be just dealing with this machine. Not dealing with only the patients at the same time, you see? So this is the second criteria. The third criteria, when I talked about the sickest people who needs emergency intervention. So now we can prioritize the patients based on their needs. There are some cases that they have time to, they know they don't need extremely emergency intervention. Then in this case, we will give the priority for those who need emergency intervention. this is the third criteria, and then we move for another criteria, and then for other criteria, as we have as all the patients has equal position. Why? Because at the end we have to do this balance, and we have to balance between these values. We have to put clear and measured criteria that to avoid any personal preferences or political intervention or any other advantages, to be just and to save all the key values that govern this situation. I hope that I explained this clearly. Now, the second point that in this case I already answered the second question, even about the balancing between values, the first and the second question. I still I didn't get the point. I didn't understand the question about the immunity, but okay, I will move for the last one, the last question. What's the difference between ethics and jurisprudence, fiqh? I already wrote 4 articles in the Journal of Islamic Ethics and in other journals about the difference between fiqh and akhlaq. So now we have to be aware with. We have to be cautious dealing with the word akhlaq in Arabic and in the Islamic literature, because akhlaq as a word, it has different definitions in the classical time. So, but usually it refers to a descriptive field, which is to explain the self powers based on the Greek tradition, and that the self has 3 powers, and these powers will cause the actions. So ethics, akhlaq, in the classical time was a descriptive field to explain to us how our actions exist, and this is why akhlaq comes from khuluq and khalq. You know, there's a link between create and the state of the soul. The state of the soul. So, but when we talk about ethics now, or akhlaq in Arabic, in the contemporary time, we are talking about different discipline. Different discipline. We are talking about the discipline that, as I said, it's interdisciplinary field. It's an interdisciplinary field. When we say it's an interdisciplinary field, it means that it integrates the fields that I mentioned already: Sufism, fiqh, usul al-fiqh, adab, etc. So theology. And it answers the 3 key questions that I already mentioned in my talk. You know, what should I do? The actions. And how should I live? The lifestyle, the virtues that I have to seek for and to implement in my situation, and the sources. So when we are talking about we are talking about three branches of ethics. Meta ethics. But when we answer the key questions, the major questions that addresses the metaphysical and the sources. The metaphysical dimensions and the sources, and we are talking about virtue ethics. So Muslim jurists don't speak about virtues. They usually talk about rulings, only evaluating the actions. And the third branch of ethics here is normative ethics, what we call it normative ethics. So with normative ethics, we are in line with the fiqh discussions, but akhlaq, ethics, is wider than fiqh. Fiqh is one of the components of ethics in our modern conception of ethics. It's not; they are not equal. They are not interchangeable or interchangeable, yeah.
Thank you very much, Dr. Mu'taz.
Thank you very much.
Okay, on behalf of the Center for Islam and Global Affairs, SIGA, I would like to thank our guest speaker, Dr. Mu'taz Al-Khatib. He kindly gave us a very good and informative session. He talked to us about Islamic ethics and pandemics. So thank you very much, Dr. Mu'taz. I'd like to thank everybody who has attended with us today. I would also like to remind you of tomorrow's session. Tomorrow's session is going to be on social mobility and the indigenous ruling class in the early modern Ottoman Empire. It will be given to us by Dr. Zahid Atjil. He's from Istanbul Medeniyet University here in Turkey. So please do join us. Thank you very much once again for joining us for this session, and we'll see you tomorrow, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh. And I'd like to also just really thank our brother Yunus Akdanis, our coordinator. He's put lots of effort in organizing this. So Jazakallah khair, brother Yunus, and thank you very much everybody else, and see you tomorrow, inshallah. Assalamu alaikum.
Wa alaikum salam.